Good afternoon, everyone. Thank you for joining us for today's forum session on stigmas associated with being male and seeking mental health or having mental health needs. We are happy that you're able to join us throughout the holiday season and think that it's still very important and pertinent to make sure that you have information during the holiday season and ongoing. I am Tricia Malott. I am the county's Behavioral Health Coordinating Council Supervisor. Also, as part of my staff with us today is Kevin McCall. He is our department's Behavioral Health Specialist. He will be our question moderator for today's session, which I'll explain a little bit of how to ask questions if this happens to be your first forum session that you're joining us for today. The Mental Health Action Plan, established by the county back in 2015, identified a variety of needs and focus areas, one of them being education and sharing of information with our community to reduce the stigma associated with behavioral health, as well as help link individuals to community resources, and to break down some of the barriers in getting there. So the forum was created and has been an annual event ever since. It is traditionally held in person in October. However, with COVID, our planning committee transitioned to host a virtual forum. We also decided to make some changes by doing it this way, in addition to it now being live and online. We also decided to no longer have it in a virtual format on a whole day like the in-person forum always was. So we have a variety of sessions on different days of the week, usually around the lunch hour, but some of them occurring either early morning or late afternoon, trying to target different populations of people and recognizing everybody has a little bit different of a schedule. All of the presentations that are confirmed with dates and presenters can be found on the county's website. And if you search under departments and behavioral health, there's an events tab. The events can also be found if you scroll to the bottom of the homepage. We also have a link on the homepage of the county website, as well as all of the events being posted on Facebook as well. So we hope you continue to join us for future sessions. Today's presenter is Dorothy Davis. Dorothy earned a bachelor's degree in psychology and is currently finishing a master's degree in counseling. She has passionately worked in the social service field for 35 years, helping people overcome adversity, solve problems, and develop resiliency. Currently, Dorothy is the Central Illinois Regional Coordinator for Children's Home and Aid's Parents Care and Share program, a program for parents that makes them stronger and prevents child abuse and neglect. Within the scope of her work for Children's Home and Aid, she leads the annual Blue Bow campaign in Central Illinois, which brings community awareness every April to the pervasive problems of child abuse and neglect. She was involved in the development and leadership of the McLean County Fatherhood Coalition, and she is an ACEs and trauma-informed practice trainer. We are very happy to have Dorothy join us today to be your presenter, and I am going to turn things over to her. Thank you, Dorothy.
Hello, everyone. I'm glad to be here today and excited about talking about some of the barriers men face seeking counseling. One thing I wanted to do before I got started was to offer a disclaimer. All the information that I'm presenting is research-based and studies. So I just wanted you to know that it's not coming from my own personal perspective, but this is all research-based. So without further ado, I want to jump into what are some of the stigmas men encounter while seeking counseling. And I wanted to start off by talking about the definition of a stigma, which is, according to Webster's, a mark of disgrace associated with a particular circumstance, quality, or person. So an example is the mental health field has a stigma of, if you seek mental health, you're crazy, you have mental problems. There's a lot of stereotypes that go with it. Fortunately, in 2020, I think our society is becoming a little more accepting and aware of how important mental health is, especially during this pandemic. So moving on, I wanted to talk about social stigmas and cultural issues, stigmas, and masculinity. So I wanted to start off by talking about social stigmas. So men react to public stigmas because there's a negative attitude society has toward counseling. And there's a perception that if you seek counseling, as I said before, you're weak if you seek help, that you're really not together emotionally. So the expectation is if you're a strong man when you solve your own problems, there's so many expectations of men to be strong, not to show emotion, trying to, I got this together. So that's one of the social stigmas that our society continues to have. I'm going to talk later about in the historical sense how this all came about. But even in 2020, there's still expectations of men to not show any emotional state, and there is not a positive reaction when they do. Culturally, diversity affects how men relate to counseling. Many cultures, there's a lack of trust, and they stick to the male traditions depending on race and culture. There are some differences between rural and urban areas, and that is a small town tends to have everyone knows everyone, a lack of privacy, and a very strong view that men are strong and take care of their problems. There's a lot more conformity and a lack of access to counseling help because it's a smaller area. The urban areas have more mental health centers, more privacy when seeking help. There's also more social support from the community. So those are two big differences when you look at a state and how people respond. There's also been discussed education and income has affected men seeking counseling. Men who are unemployed or have low income jobs are less likely to seek counseling. They may lack insurance or finances to pay for treatment, whereas men with higher incomes have health insurance, financial ability to pay, and transportation, and they are more likely to seek mental health assistance. The more education, the more awareness of mental health assistance, and it changes the willingness to seek help because you're more informed. Talking about masculinity, when boys are young, from an early age, they learn that weaknesses and vulnerability causes embarrassment from peers. Boys aren't really expected to cry. There's an attitude of don't cry here, you're supposed to be stronger than that. And that expectation that boys are strong, and they learn quickly that being tough and strong is an expectation from society. They plan to be leaders and handle their issues without help. Studies have shown that men feel shame and embarrassment when they seek help. So I did a study of Illinois. I had like 27 people respond. And I did that just to get an idea how men feel about counseling. So I developed a survey and I sent it out to some people in McLean County. It went to Chicago. It went a lot of places. So we did get a good response for a short period of time. So McLean County had 12 responses and 44%. And see, in Illinois, but not in McLean County, there was, there was 11 responses, and we had 4 responses outside of Illinois, which was kind of exciting. Moving on to the next section. First question 2, if you had a mental health issue, would you likely seek help? Surprisingly, the outcome was yes. 20 of the 27 responded yes, they would seek help, and 5 said they wouldn't. So that's exciting because that means the mental challenges are starting to change and men are more aware. It was a small amount of men I surveyed, so it'd be interesting if I could get a bigger pool. Question 3, from whom would you seek help? And that was mental health providers were the top answer. Faith community was second, and family members were third. Friends were fourth, self-help groups, and then I would not seek help. There was zero response on that, so that was nice to see. And then question number 4, which of the following concerns would be a barrier to you for seeking help for a mental health issue? And the responses were shame about the issue. There was 11 who responded. The top one was money, which was an interesting choice. Money is too tight to spend on mental health was number 1. So that makes a difference, I guess, income-wise, which makes sense because if you don't have any insurance or your finances are tight, that's not the top thing you're going to worry about. And then moving on to question number, sorry, my little cursor's sticking. Question 5, have you ever sought help from a mental health professional? 14 people had said yes, and 13 had said no. So that was another positive outcome. And question number 6, if you got help, did it help resolve your issue? And 11% said yes, it did help. And 6 people did not, said it didn't help, but I don't have the information on why it didn't help. So I just thought that was a good little survey to help people kind of see how McLean County and Illinois feels about mental health counseling, and it is a positive. I'm glad that people are willing to seek help. So next, I wanted to talk about the historical stigmas about men seeking mental health and a brief overview in history to show how the stigmas have developed. So I want to start off talking about the Georgian period, 1714 through 1830. This is a period where nervousness and good blood was accepted in higher class men and women. There was a focus on the central nervous system, and many physicians thought many diseases and afflictions were connected to it. Nervous conditions was accepted in the well-to-do class, who were thought to have a more refined nervous system. Being manly in the Georgian period was being virtuous and wise. Rich men were allowed to express their emotions and discussing their psychological health. A physician, George Chain, wrote an article about symptoms of melancholy, low spirits, insomnia, and agitation. Bad nerves and good blood were seen together with an emphasis on class system. The poor were just seen as criminals and alcoholic. There was no allowances for the poor to have nervousness. So then I wanted to move on to the Victorian period, which is 1837 to 1901. A huge change in cultural and social changes. The industrial nation took place in Britain. Power and control instead of male nervousness took place. Factory work, mining, and construction was a male environment. Women were symbolized as taking care of the home, and that was a Victorian label. You took care of their children, you took care of the home. Charles Darwin and Herbert Spencer emphasized core differences between men and women with their evolutionary theories. Women were considered inferior to men because of their reproductive systems and irrationality. Men were seen as restrained beings. The Protestant religion valued willpower, obedience, and fidelity. Christian men were good husbands and fathers without emotional expression. And the British military had a part in this as well. They had values of strict stoicism and the famed stiff upper lip. So no expression was good. I want to talk about also the Edwardian era, which is 1901 to 1910. It consisted of the shared values of national pride and imperialism. Male authority was everywhere: the military, the schools, churches, and other organizations. There was an emphasis on courage and strength, which equaled manliness. Mental illness was confined to social problems such as crime, alcoholism, and vagrancy. And mentally ill patients were in asylums, and there was suspicion of psychological approaches. Freud's theories were not respected in England at this time. Along with that came the military. After the First World War, there was something called shell shock, and men struggled with trauma such as tremors, anxiety, heart palpitations, and the doctors began to consider a psychological cause for war trauma. There was still ambivalence and mistrust of psychological treatment, but they did allow for the military and the soldiers to possibly have a psychological problem. And we move on to the 20th century. The ideas from the Victorian and the Edwardian era were precursors to men being less likely to express their feelings and seek help for their mental health problems. Some thought after World War II that somatic symptoms were a mask and an excuse to see the doctors. Physical problems were more acceptable than any psychological issues, and doctors tended to dismiss anyone that came in with, mental problems or stress or depression. That was not acceptable. The term neurotic was assigned to women with anxiety, but not to men. In 1950 through 1980, doctors had a hard time relating to psychological issues in men. Doctors admitted that they weren't poorly trained in psychological medicine and focused on women having mental disorders, not men. So there was a lack of training even back in the 70s and 80s toward men having problems. Currently in our today's society, there's an awareness of men and mental health issues that are opening up doors to change the negative mindset toward seeking help. The term holistic wellness focuses on body, soul, and mind. The medical field is focusing on connecting mental health with physical concerns. So we have progress in 2020 as we go along. I'm so glad to see that. So the next area I want to talk about is societal roles in perpetuating mental health stigmas. I'm focusing on some of the gender differences in our society. And number one, I want to talk about men the protector. In our society, the role of a strong and controlling man has been a barrier to men seeking help. The focus that men protect women and children as well as his home has been a stereotype for hundreds of years. Aggressiveness and anger are seen as okay, acceptable behavior for men. And in the past, men looked up to men who were aggressive and respected them for it. Men the provider, men were viewed as the breadwinners that worked to take care of the family. There was a trend for men to be in science and technology and assumptions that they had analytical minds. Men were not pursuing fields such as nursing, social service, or teaching, and those were seen as women's careers. Luckily, in today's society, there are more men in nursing and teaching and social services, and I hope this will continue to increase. Another factor was men as leaders. Men were seen as competitive and powerful in today's companies, and most companies, even in 2020, are ran by men. Their opinions are seen as authoritative, and they are aggressive, and aggression is okay, and they like a dominant voice in the company. So this is a big piece that still needs changing, but they are changing. There are men in all fields, and they all work together with women to provide for families, for businesses, and there are even women CEOs and leaders currently, which is a good thing. So the next topic is common mental health concerns men have. Now, I am not an expert in this area, but I tried to gather a little information just to make people aware of some of the stigmas with these mental health conditions. And the first one I wanted to talk about was depression. Men are less likely to seek help for depression or talk about it. Depression can appear as anger or aggression instead of sadness. Mental health issues can be seen as health problems when seeing a medical provider. Heart palpitations, chest tightening, headaches, or digestive issues are not usually connected with mental health. And some of the causes of depression are genetic factors, a family history of depression, environmental, financial, work issues, marriage, and stress. Cancer, also illnesses, cancer, diabetes, heart problems, kidney disease, to name a few. So the next topic is suicide, which relates to the depression. In 2017, the suicide rates for men was 3 to 5 times higher than it was for women. Middle-aged men accounted for most of the suicides in 2017. Women have more attempts, but men choose more lethal methods, such as shooting themselves and hanging. The World Health Organization reports that suicide represents half of all male deaths nationwide. And the age range that is the greatest risk is 65 and older. And I think that a lot of that has to do with retirement and being at home and losing your focus on what you can do. Some of the factors that go along with suicide are alcohol and drugs. Male roles discourage emotional expression. This seems to be a theme. Men do not disclose feelings of hopelessness. Men are less likely to seek help for emotional problems. And I have included, I just want you to know there's a suicide hotline for people who need help or feeling suicidal even currently. It's called the Suicide Hotline, Suicide Prevention Hotline. And the number is 1-800-273-TALK. Again, 1-800-273-TALK. The next mental issue I wanted to talk about is anxiety. Men are less likely to be diagnosed with anxiety than women. Anxiety may appear in men as aggression, which is socially acceptable, or burst of anger. Men may seek alcohol and drugs to help with anxiety. Anxiety disorders can be associated with suicide attempts. And anxiety also can accompany depression. Some of the symptoms are nervousness, restlessness, a sense of impending danger or doom, panic feelings, increased heart rate, sweating, breathing rapidly, or trouble concentrating about anything but the present worry. So those are some of the anxiety symptoms. Men are not, the doctors still don't catch this a lot of times because men don't disclose it. They really don't talk about it, so it's more seen as a physical problem. And then there's post-traumatic stress disorder, and that replaced the term shell shock for the military. So it's more acceptable for military men to have PTSD. It's not usually diagnosed in men. Women are easier to diagnose. And it's been said men experience less trauma and less symptoms after an incident. The time frame is even different for men in response to trauma. Usually after 1 year, men have kind of taken care of the issue and moved on, whereas women will struggle with PTSD for years. And I think it is also related to a lot of the content. Women experience more sexual assault and abuse. Men experience it, but they won't process it. And they rationalize or compartmentalize it. And PTSD in men is, like I said, the doctors expect them to have trauma if you've been in a war experience, but there's not that expectation currently that they would have trauma as much as it would be for women, which is not true because men experience things. So how can men get help with mental issues? Well, I want to talk about community resources. McLean County is really blessed. We have a lot of things that's available to men. Counseling centers, men's support groups. The McLean County Health Department has a behavioral health area. Chestnut Health Systems. There's NAMI, which is National Alliance on Mental Illness. Integrity Counseling. And most importantly, if you have an issue going on, currently you can call PATH 211 and ask for help, and they can give you resources, which I think is very important right now. There's many more counseling places in town. I didn't specify a lot of them, but they're great resources here. Another community resource is your job, employment. Most businesses have an EAP program, or you can talk to your supervisor, or there's sometimes a designated person who handles physical and health concerns, and you can reach out to them. Medical staff is also invaluable. Having doctors and nurses, if you have a nurse in your area or in your program, that's a good resource, or a doctor. Churches are another big support system. They have a lot of support groups, group leaders, there's pastors, and they have a lot of resources, so that's a great contact for men. One thing our agency had, and I wanted to just bring it up, we have a program called Dads Uplifting Dads, which is a group. It's a parent group, and dads go in and they just can talk about whatever they want to talk about. And they also have a lot of resources and connections. It's a parent care and share group. In the healthcare field, as I mentioned above, doctors, medical clinics, and the emergency room all have resources for help. So now I wanted to kind of talk about what puts men at risk for mental health issues. These are just from my studies. But again, employment comes up. Job stressors, finances, not having a job, career advancement can all put a lot of stress on men. Trying to figure out solutions to those things, and you don't know who to talk to, so you just struggle along with it. Family issues can also cause problems, relationships with spouses, parenting, finances, budgeting, all those add to the risk factors. And then, of course, there is trauma. Trauma is car accidents, military past history, abuse, death of family members, feeling overwhelmed. Talking about that, I would like to bring up ACEs, which is Adverse Childhood Experiences. It focuses on negative experiences that happen when men were younger, but never addressed. And we're learning that the more aware parents are, and schools and other programs, to pay attention to kids instead of labeling them as ADHD or behavior disorder, a lot of times some of their behaviors are related to stress. And I know that putting a focus on that helps the school identify kids in a positive way and try to reach out to them and help them and try to discover what's going on. So, and I know McLean County is using ACEs and TBI, which is trauma-based interventions, in their schools to help locate this stress that is going on with kids. So that's a good thing. Divorce, losing a spouse, it's a big life change, and lots of times it ends in anger and frustration. Parents are separated from children, and it can cause a financial strain. And this, I separated it from family because divorce is a big stressor for people and a big stressor for men. You're used to having a family, you're used to having a home, you're not used to being on your own. You no longer have the spouse to talk to about problems. So it puts men in a position of aloneness and feeling even more separated and not knowing what to do with their emotions. So I just kind of wanted to focus on that a little bit and keep it separate. So there are mental health resources for men, and that would be the community resources are very important. Medical resources are very important. I've touched base on a lot of these, employee assistance programs. And I think just feeling comfortable being able to talk to other men or talk to other employers or coworkers or friends and family about some of the things they're dealing with is so important in our society right now. I really feel like the societal, as I talked about, from all the past history of men the only way they could show their feelings is to get angry, be aggressive, or be, out of control in a negative way. We need to open up our minds and hearts and allow men to be okay with sharing their feelings. I'm not saying they have to cry, and if they want to, that's okay too. But I'm just saying being open to, if you see a guy struggling with something, just saying, hey, how you doing? Or, I've had conversations with men, and I've worked in different settings. I worked at the hospital. I worked in treatment programs. And one of the most interesting things I noticed is when you sit down with somebody and you just start talking to them, they start sharing and you can help them. You don't have to judge. You just can offer a little a comfort, respect, and letting them know it's okay to share your feelings. It's okay to talk about them. It's okay to be upset. It's okay to use the word sad and depressed and lonely. It's okay. You don't have to be the tower of strength. You can be vulnerable and transparent and not have so much judgment. And I hope our society continues to move in that direction, instead of feeling so judgmental and locking people into stereotypes from years ago. So, I think that's the end of my presentation so far. I hope that it's been helpful. I hope that it's opened up some eyes and opened up some opportunities for you as men. I hope it makes you feel respected and cared about, because that's so important. So thank you so much for listening. Again, I want to make sure my disclaimer, this is all research, but it's studies and it's proven. So.
All right.
Thank you.
Thank you, Dorothy. For any attendee who has questions, you can type them in the questions box, and then Kevin will read them to Dorothy. Dorothy, I wonder if in the interim, while we wait for questions to come in, can you talk a little bit about what you think it may take to continue progressing and continuing the shift to move away from some of those societal expectations of men to keep it together all the time, to be the protector and the provider and the leader? What do you think is needed to continue to move the needle to help men's well-being?
Well, I think it starts with children. I think it starts with parents. I think it starts with teachers. I think we as professionals, we've got to change our perspective. I'm studying about counseling men right now, and one of the things is women tend to stereotype and treat men just like they would women coming to counseling. And we've got to change our expectations. And men are more logical, more straightforward. They want to know, how many sessions is this going to take? How long am I going to be here? How much is it going to cost? Whereas we as women are more used to disclosing our emotions and our feelings. And so we have to stop trying to make everybody the same and respect everybody for their differences. And I think if we can do that with a mindset of it's okay, instead, even when I was going to college and stuff, the expectation was I was going to marry a guy that had a good job and he was going to help take care of me, and the whole Cinderella syndrome. And I'm hoping in today's society, young people have a different viewpoint and seeing themselves as valuable, so men aren't pressured to be all that. Let's just let each other be what we are. Accepting people and respecting people where they are is going to be a big piece of that, Tricia. I really feel like if we as professionals get on board and stop stereotyping and being more open-minded and culturally sensitive, I think we will see some changes. I think we've already seen some changes. I think the medical field, I know there's some medical offices that even have a behavioral health specialist in their office. I think doctors are more willing to ask the questions. I think nurse practitioners are more willing to ask the questions that they need to ask to see if someone's struggling with depression. And I think we're moving toward it. It's just a slow move from those stereotypes. And we as parents have to change how we teach our kids, and expectations of them to be strong guys. You got to be strong and this and that. We got to change that. Teachers got to change that. You can't cry in my classroom. Businesses have got to change their approaches, even in social service. Working in the Fatherhood Coalition, we talked about how things in social services geared toward women. They're not geared toward men. You go in and pick up a magazine, it's usually geared toward a woman. The colors are geared toward women. How we work with them, we're geared toward women. We have got to include the men at the table to talk about issues of parenting, struggling, whatever, and not make them feel like it's an embarrassment that you showed up at my desk. And a change mindset is the #1 key to changing everything else. And I'm glad we are doing holistic wellness in our healthcare programs. I'm glad that mental health is talked about more. During this pandemic, I've seen the self-care talked about more than ever I've ever seen it. And it's not just for women, it's for anybody who's struggling with being, quarantined or trapped in your house and you can't go places. I mean, it's for everybody. It's no longer just geared toward women. And I think as we change those thought processes and become more transparent and honest and open-minded, I think we'll see a shift in men getting the help they need. It was pretty scary for me to read that 3 to 5 times more men commit suicide than women. That's awful. But you never hear about that. It's usually a stereotype that women commit suicide, but it's actually women attempt and men don't. That's scary to me. It's sad to me when men, even on my survey note, said that shame and embarrassment is still a part of why they don't go to counseling. And making it affordable and accessible is important. So those are just some of my takeaways. Trisha, I hope I answered your question.
Yeah, thank you.
All right, and I am not currently seeing any questions on there, so I'll just pass it back to Trisha then. If anyone does have any questions though for Dorothy, I'm sure you can pass those along to either Trisha or myself, or I don't know if Dorothy directly has provided her contact information, but you can reach out to either one of us and we'll get an answer from Dorothy for you.
Yes, so we'll thank Dorothy again for her presentation today and taking time to talk to us about some of the stigmas associated with men seeking mental health treatment, and her discussion, more recently about, that a lot of this not only comes from professionals within the community, but community members and parents having an influence on their children, as well as in the school settings, that we all start to take a shift about how we approach males of any age. And as just one example, not shutting down crying or having emotions, and allowing them to freely express it the way that society has typically allowed for females. So we're really grateful for Dorothy today. If you missed a portion of today or want to view it again, it will be put up on the BHCC YouTube page, there's a link on the county website to make it a little bit easier to find. So we do put all of our recordings up there, and they usually go up within 1 week after. Sometimes it's within a day or two. With the holidays, it may take a little bit more time. Our next session is next week, so feel free to take a look and register for that as well. And we hope you continue to join us as we move forward throughout our virtual 2020 and 2021 sessions. And thank you all for your attendance today. Thank you, Dorothy.
Thank you.